Welcome to Dental Nacho CE on TV. I'm Paul, Dr. Nacho Goodman, living my backup dream. My primary dream was to play professional basketball in the NBA. That dream failed, didn't even come close. When you grow to this height and have this speed, you got to get new dreams. So now, as the founder of Dental Nachos and Dentist Job Connect, I am out here with my amazing team, helping dentists laugh, learn, and feel less alone, helping them increase success, decrease stress, and most of all, reduce the number of times they feel like crying inside a day. That is the number one KPI of all dentists and team members out there. How many times do you feel like crying inside a day? When someone says, my sister's insurance covers 33 veneers, and you want to say your sister's a liar because max you have 32 teeth, but you don't say that. You just keep it in your head. You cry inside and say, that sounds like good insurance. What else makes you cry inside? Sometimes when you're doing one of those class 2 things and the ring thingy flies across the room, pings around on the floor. You look to your dental assistant and said, I need a new class 2 ring thingy. And they open the box and all you see inside there is a mangled pedo ring. And you're working on a number 15 on a 50-year-old and say, perfect, that one will do. Well, we are here to help you cry less inside. I am so excited to have my friend, Dr. Elaine Bylis here. You can start your video. Dr. Elaine, we will chip chat for a few minutes before we get started. So you are the star of CE on TV. Our CE is not started yet. We're going to talk a little bit about you. You are an amazing role model to dentists everywhere. Tell us a couple things. Where do you practice dentistry? Where do you do your dentisting thing?
I am located in Glen Burnie, Maryland, in Anne Arundel County.
Awesome. And you graduated from dental school when?
In 2017, 6 years ago.
6 years out. I classified dentists from baby age dentist to toddler age dentist. You're a CAD, child age dentist. You're not at the MAD stage yet, where I am, the medium age dentist. So tell us a little bit your daily dental life. Who are you working with? A little bit about your practice style. Tell us about that.
So I actually practice with my dad.
Awesome.
We have this incredible general dentistry practice. We do just about every kind of dentistry. So we do orthodontics, we do surgeries, we do your regular class 2s. We cry a little bit when the ring goes flying across the room. We do have a pretty strong emphasis on cosmetics, so be that composite and porcelain veneers.
Awesome. You got a shout out. Go Elaine, my Baltimore babe. Laya, go Tab. So you guys all put all your comments to everyone, not just us and the panelists. So please put your comments everywhere. So people watching in. So the topic you're going to talk about, I'm turning this over to you. You can share your screen just to make sure shares. While we're going to talk about resin composite veneers from planning to treatment. Composite veneers are excellent and minimally invasive technique for enhancing the appearance of teeth in a way that can rival porcelain. They can be used in a variety of clinical scenarios and allow clinicians to treat a younger patient base than can be treated with traditional porcelain veneers. I'm so honored to have you here. I'm going to turn over the CE on TV show to you. The way it works, great phrase. I talk to people, the way it works, and they say, what does my insurance cover? I say, great question. A lot of people ask me that. The way it works is dental insurance works like a coupon with blackout dates, a coupon with restrictions. We are going to do the best job possible to maximize the benefit of your coupon. So the way it works is that Elaine will deliver CE to us through the power of the internet. If you have questions, please ask them in the Q&A. There will be time for that. Elaine, if you need us for any reason, I'll be back here dreaming about guac. You got some chips and guac though from us to fuel you for the show?
Guys, that was incredible. My belly is so happy.
Awesome.
My cat was a little bit jealous.
Yeah, your cat was jealous. What's your cat's name?
Carabelli.
Oh, Carabelli. I no idea why you named that cat Carabelli. I cannot.
And I'm getting a second one, and it's going to be named Intaglio, aka Taggy. Both Italians.
Yeah. But you could just the inside. Well, I'm going to turn it over to you, Elaine. Thank you so much for being here. If you need me, I'll be in the back. Everyone watching in, honored that you're here to learn from Elaine.
Well, thank you so much for that introduction. And thank you all so much for being here today. I am so excited to be here. And thank you to Dental Nachos for inviting me to speak. This is just such a great opportunity. And I'm so excited to hang out with you guys. My name is Elaine Bylis. I am a general dentist. I practice in Maryland, and I have the amazing honor today to speak with you all about my art and my passion, which is Resin Composite Veneers. The case in this slide, this was actually on a close friend of mine. Her name is Lexi. And we were back and forth. Should we do 6 veneers? Should we do 10 veneers? And I will jump into why it's okay in composite to do 6 veneers. It's not quite as great in porcelain. But for Lexi's case, we decided to start off with 6 composite veneers. So that's what we're showing in this photo. And I think it blends really beautifully into the corridors. And it looked really good. But then Lexi, she's all about looking beautiful, having the whitest, brightest smile possible. So we did go back and do the 10 composite veneers. And so here she is with her 10 composite veneers. And I just love the look. I love how well it fits within her face. I think it's a really bright and beautiful and natural smile. And in terms of disclosure, so I'm going to be talking about a lot of different products and materials today, not because someone is paying me to say it, but because that's how I really feel. And this is our practice. So if you look closely, you will notice that there are 2 Dr. Bylises listed. It is me and my daddy, and we have so much fun working together. And this is us. And I'm so fortunate to work with my dad. He is one of the most talented clinicians I've ever seen. And I am so fortunate to have him as a personal mentor of mine. I've learned so much just by working for him. And it's pretty interesting. We have this amazing synergy together. My dad, he was trained in the 80s. And so when he approaches a case, he tends to take a more analog approach. If you give me the same case, interestingly, our end results end up just about the same, but my technique tends to incorporate more digital elements. I am not fully digital. And so for our cases, every single cosmetic case that comes out of our office is hand wax. And so that part we choose to keep analog, but I tend to incorporate a little bit more digital techniques. And so I'm going to go through a couple of those today. And this is me, our office. We are on socials. We would love to have you follow us if you want to see more of these types of cases. You can also reach out to me there or shoot me an email. I would be so happy to get back to you. And this is a day in the Bylis dental office. And so we're not just composite and porcelain veneers. We do quite a bit of surgeries as well. So this is a maxillary all-on-X. And interestingly, in our practice, we do all components of the surgery. So we digitally plan and place the implants, we design and fabricate the surgical guides, we do the surgery itself, and we do the final prosthesis at the end. So everything gets done in-house. And then this is another case that came out of our practice. And so this is a porcelain veneer case. And so I think when a lot of people think of our practice, because we're better known for our composites, people think that that's all we do. But in our practice, what we do is we have a patient, we educate them on both materials, the risks and benefits of both, and then the patient gets to make an educated decision on what they think is best for them. So this was a 12-unit porcelain case. This was done on a very special patient because it was done on my daddy. And I love the way it turned out. It's very natural and beautiful. And I just love this picture of him and my mom. And here's his before and after. And I'm just going to touch on a couple of the things that I modified on this case to get that pop at the end. So one of the things is I thought the embrasures were a little bit wide on the before. And so I went ahead and closed them up a little bit for the after. I added about 1 millimeter of length in that anterior segment to really fill in the smile. I think it looks a lot better. And the one that I think really makes a difference in the smile is I added 1 additional unit. So I took him from a 10-unit case to a 12-unit case in the after. And that additional unit really fills out the smile and takes away that black spot in the corridors. And here we are the day of treatment. So I was treating him, and I think it was payback for all of the times that he has treated me. But anyway, let's jump into it. So the first thing that I want to talk about with composite veneers is why we would do a composite veneer and why we would choose to do that over a porcelain restoration. And there's many different reasons why we would choose this type of restoration. So thing number one is it requires minimal preparation of the tooth. So most of my composite veneer cases, the entire tooth remains underneath of the veneer. So all I do is I just roughen the surface of the enamel and then just bond directly onto the tooth. So it makes me feel really good because I don't have to ever cut away healthy tooth structure just for the sake of cosmetics. And then it also allows us to treat a younger patient population that we wouldn't necessarily want to treat with porcelain restorations. No numbing is needed for composite veneers for me, unless I'm doing some type of change to the gum architecture, which for me, it doesn't really change anything, but the patients love the fact that they can do that type of cosmetic change without having to get any type of numbing for the procedure. The results are same day. There's no insert appointment. And so for porcelain veneers, you know, you could take a couple hours to prepare the teeth, but the case is not over. So for me, if I'm doing a 10-unit porcelain case, that could be a few hours for an insert that I have to leave aside from my schedule. That's really, it's no production in order to finish the case. But with composite, after the day that we treat the teeth, the case is done. I don't necessarily have to ever see the patient ever again. So we'll do like a quick 15-minute follow-up, but that's really the extent of the appointments for composite. The shapes can always be adjusted, unlike porcelain. So when a porcelain case goes in, the shapes are kind of the shapes. There's not really much that can be changed. But for composite, I get that peace of mind that I can add a little bit, I can take away, I can do any type of modifications of the shapes of the teeth according to whatever the patient thinks is best, or if I think that I need to change something with the case. And then on that note, they are repairable. And so for porcelain, if something breaks, sometimes you can repair it, but a lot of times what you have to do is cut off the entire veneer, put the patient in a temp, get an impression, send it to a lab, do another insert appointment. So it adds a lot of time versus if something breaks in composite, I take 15 minutes out of my schedule and I just put it back. I find that I can be more creative in my treatment planning with composite rather than porcelain. So with porcelain, at least in my hands, there's really only 3 treatment plans. I can do 2 teeth, I can do 4 teeth, or I can do 10 teeth. But with composite, because it blends so beautifully into the corridors, I can do any number of teeth. So I can do 1, I can do 3, I can do 6, which is something that typically we don't like to do in porcelain. I've done 7, I've done 9, I've done any number of composite veneers, just whatever is needed for that case. And then finally, there's no lab involved. And so the clinician has complete control. And so I've had instances where maybe I was going to do an insert of a porcelain case, and for whatever reason, the case couldn't go in. Either the aesthetics weren't right, or the color wasn't right, or there was an open contact, or something didn't go right, that I had to box up the case, send the patient back home in temps, and then bring them back for an additional insert. And that's really just not an efficient use of my time. So for composite, if there's something wrong with the case, I go through and I fix it right then and there. And so I don't have to add all that extra time to the case. And then finally, for those who are financially conscious, there's no lab fee. And so the overhead for these cases is much more minimal than what it would be for a porcelain case. And so in our office, we actually pass some of that savings onto the patient, where our fee for a composite veneer is actually a little bit less than a porcelain veneer. And then really quickly, I just wanted to jump into the creativity that we can create with composite over porcelain. So first, I'm going to show a 6 veneer porcelain case. So this patient, fabulous guy, he's a smoker and he has dry mouth and he got a lot of decay on his front 6 teeth. So much so that I could not repair it in composite. I actually had to go in porcelain. And so it was the front 6 teeth, and I begged him, please do not make me do 6 porcelain crowns. But for his case, for financial reasons, that's all he wanted to do at the time. He promised me that he would come back and do more, which he has not, but I hope that one day he will. And if we look at his after, I think we can agree that I got the closest color match physically possible to those back teeth. However, when we look at him straight on, what we see a lot of times with 6 porcelain veneers is when they give that big smile, it looks like they have 6 teeth in the front and nothing behind. I think this is because of the difference in opacity between porcelain and natural teeth, where most of the time when I see a 6-unit case, and there are some exceptions, but a lot of times it has this type of appearance. Now I'm going to contrast that with composite. So this beautiful girl, her name is Rachel. She was about to get married and her teeth were gorgeous, but she had these little spaces in between and then a baby tooth at the site number 6. And so it was the same treatment plan, except this time we used 6 composite veneers instead of 6 porcelain veneers. And so here is the final result. And when we look at her full face, I would argue that it's tough to tell which teeth are the veneers, and it doesn't stand out at you as being 6 veneers in the front and nothing behind. And what I attribute this to is I use the canines as my transition tooth. So the fronts of the canines are built with veneer. The backs of the canines are still her tooth. And so it serves as that transition between the veneers in the front and the natural teeth in the back. Now, before I move on, everyone, with every perfect, amazing material and procedure, of course, there's going to be some disadvantages. And so I'm just going to jump through these. These are the ones that I always hear. And I'm going to go through a couple of the ways that we can mitigate these disadvantages. And so the first thing that I'm always hearing is that, oh, they're going to break or they're going to stain. And there's some things that we can do to make these veneers stronger in order to minimize that possibility. So thing number 1 is proper bonding technique. So these things need to be applied in complete absence of moisture, really good light cure. And a lot of times, if you do that, they're less likely to break. And then, of course, they have to be kept in good occlusion. So that means in maximum intercuspation and in excursives, there can't be any interferences. Otherwise, something is going to break. And then finally, patient education. I beat this to death that patients need to understand they cannot use their teeth as a tool. So that means no fingernail biting, no tearing open a bag of chips with your teeth. All food items are okay, but non-food items cannot touch the veneers. In addition, they require an artistic eye. And so a couple things that I do. First off, every case is more practice. You have to get cases under your belt. And every time I do this, I learn a little bit more and I find that I get a little bit better at this. Next thing is I do all my own wax ups. Me and my dad hand wax every cosmetic case that comes to our practice. And that does 2 things. First off, it allows me to learn the case, where I'm going to be adding teeth, where I'm taking away, how I'm going to modify the gums. And then thing number 2 is it serves as a practice round. So when I go to build the veneers by hand, it's the second time I'm doing it. I've already practiced once in wax on the patient's model. And then finally, I photograph all of my cases. And it's really mind-boggling how much you can learn from the photos, where something will look perfect naked eye when you're just looking at it. And then I go to study the photos of my cases and I see that there's little things that can be improved for next time. And then finally, they require special care. And so first off, we want patients to use a low abrasiveness toothpaste under 80. You can Google search the abrasiveness index to get that chart that we hand out to patients. And then finally, when patients come back for recall visits, their composite veneers, just the facials, instead of polishing with that gritty prophy paste, we polish them with Cosmedent's Enamelize. And that's just the facials, the linguals are fine. Okay, so facial-based smile design. So this is kind of my approach to treatment planning my cosmetic cases. And I'm gonna run through a case as an example to show what I mean. So this is Andrew. Andrew came to me from DC. He is married to one of my best friends named Bonnie. And I did 6 veneers on Bonnie. Andrew has no interest in getting anything done. His mom and his wife are the two that sent him to me. He thinks his smile is fine, but because those two ladies wanted it, he ended up in my chair. And so really there's two things that we consider with Andrew's case. So first off, his teeth. So his lip has a nice curvature to it, but his teeth are worn pretty flat across. And if you look closely, which I realized from the photos, his teeth are slanted on an angle up and to the left. And so my first step when I have a case like this, any cosmetic case that comes to our practice, is facial-based treatment planning, which in my case, because I use Photoshop, I call it a Photoshop smile design. And it doesn't have to be Photoshop. There's so many different ways to do it. It can be PowerPoint, it can be Keynote. There's any program that you can take a patient's photo and then change the shapes of the teeth on their full face. And so what I do, take the patient's photo, play with the teeth, and I'll come up with different options to simulate different cosmetic results with the case. And really that does two things. So first off, it allows me to come up with the exact plan of how many teeth I'm going to treat. And so I can have a pretty general idea just from looking at someone, but this way I'm able to come up with an exact plan, how many teeth, what the gums are going to look like, everything like that. In addition, I'll come up with a couple of different plans and I'll show the patient all the different options. And then the patient can see what they look like and then make an educated decision on which treatment they want to go through with. And the Photoshop smile design, it takes me all of 5 minutes and I do not charge for this procedure. And so here's Andrew, here's his photo. I'm going to go back and forth now. This was his Photoshop smile design. And so I think we can agree that, and it was 7 teeth, so it's 7 composite veneers. And I think that we can agree that this looks more in harmony with his face. And so now I'm off to the races. So here is a close-up of that digital mock-up. And the red is showing where I'm adding length. And what I want you to appreciate, because that smile was slanted, I'm adding much more length to the teeth on his left side than I am to the teeth on his right side. So this is a very challenging case. And this is a retractive view. And so this is as if I have Andrew's models sitting out on my bench top. And what I want you to see is the teeth and gums go up at the same wrong angle. And so had I not taken the time to do a facial-based smile design, I would have become very lost in this case, because what I would have done had I not considered the full face is I would have waxed this case. I would have made these beautiful teeth, these beautiful veneers that would have gone up at the same wrong angle, and it actually would have accentuated the cant even worse than it already is. But instead, I used the facial-based smile design, and this was the plan that I came up with that, once again, goes on a completely different angle than everything else in his smile. And so my next step, so I take the Photoshop plan and I make my wax up. And so I hand wax the case based off of my plan in the Photoshop. And so here it is. And once again, the teeth on his left side are approximately 1 mile longer than the teeth on his right side. But I've done the planning ahead of time in the Photoshop, and I just have to trust my plan. And then here's Andrew the morning of treatment. And what we started doing in our office is we started taking same day treatment photos, because a lot of times after we improve the teeth, a lot of things start to change aesthetically. So the patient will change their hair, the guys will shave, the ladies will change their makeup. And a lot of times people and even dentists attribute how much better they look to the new look and not to the teeth. And so now we take same day photos. The only thing that changes is the teeth and the fact that we just beat them up in a dental chair for like 5 hours. And so here's Andrew in the morning. And here he is that afternoon. Same outfit, same hair. That's the new smile. And so here is his same day before and after. And I think now we can confirm that even though my vision looked a little strange on the models, it was in fact correct for his face. And so the Photoshop really works. And so same day, before and after. And what I want you to appreciate is it's exactly the same as his Photoshop. And so I've gotten this technique to a point where I can very reliably take a 2D rendering, which is the Photoshop, and then transfer it onto a 3-dimensional model and reliably recreate it in the patient's mouth. So here's his before and after, retracted view. And once again, you can see, so the teeth and gums now go up at different angles. And I didn't modify the gums because even on his biggest smile, he never shows gum. And so I only do gingivectomies in situations where the patient smile is really big and you can see their gum. And I included this photo. So when we do composite veneers, we do 2 teeth at a time. So we do 8 and 9, 7, 10, 6, 11, and then 2 premolars on each side. And so for this, the reason why I show this is because 8 and 9 are going at a completely different angle than the rest of the teeth. And this just shows the importance of waxing a case ahead of time and then making a matrix to guide where the edges of the teeth are going to go. Because I really believe that if I tried to freehand this case, I would have gotten really lost with this. I'm just not talented enough to be able to fix a cant freehand. And so that's why the matrix for me is so important. And then this was just a funny photo. So after we finished the first 2 teeth, it almost always looks really ridiculous. And so when Bonnie checked in, I sent this back to her. I was like, okay, we're done. But we were not done. And I just love this photo. These might be the 2 most beautiful humans I've ever seen. And I am so proud to say that I did veneers for both of them. So I did 6 veneers for Bonnie and then 7 for Andrew. Okay, so now we know how we plan a veneer. So now I want to talk about all the different ways that we can use composite veneers and composite resin, because there's so many different possibilities and is such a versatile and amazing material. So the first type of case is color correction and arch expansion. So this is just your traditional veneer case. This can be done in composite, this can be done in porcelain, but in this case, I'm going to show composite. So this is Beth. Beth is married to a patient of ours that we did a 10-unit porcelain veneer case on, and she loved the way it turned out. He looks amazing. He's actually on TV and it's like the perfect TV smile, but she saw the process. I did that case when I was about a year out of school, and she saw how many appointments it entailed. And she said that she knew herself and that she wasn't willing to come in for that many appointments. So, I mean, for someone like her, she's in her 40s. Nobody would argue with me to do this case in porcelain, but because of that limitation, that pushed me more towards composite. And so in terms of her chief complaints, so number 8 is discolored. So there's some type of trauma when she was much younger. So 8 discolored. There's a PFM on 9 that doesn't quite match the rest. Her arch is a little bit narrow. And so we talked about different treatment plans. We talked about different ways that we could go with this case. And she really liked the idea of composite because it's one day, you come in, I treat it all, and then it's done. She didn't have to come in, to check the temporary. She didn't have to come in for an insert. For her husband, one of the teeth had an open contact, so I had to send him home and then bring him back for a second insert. And so she loved the idea of one and done. And interestingly, she has that crown on number 9, and it's a PFM, and there's nothing wrong with it, right? I mean, it's an older crown, but there's no decay, it's healthy. And so I told her, look, I've never done it before, but I know that composite can be bonded. So I've bonded to porcelain, but I've never done it as a veneer. And so I told her, look, why don't we try it? I can bond to the PFM. We can see how it looks. If it doesn't look good, we can always go ahead and cut the whole thing off, do it in ceramic. But we decided, hey, we'll give it a shot. We'll see how it looks, and then we'll proceed from there. And so here she is before, and the treatment plan, once again, is for 10 composite veneers. So my first step for every cosmetic case is the Photoshop smile design. And so here's her photo. I'm going to toggle back and forth. And you can see this is my plan for the 10 composite veneers. And so I think it looks really nice. It's in harmony with her smile. So once we have this approved, I'm good to hit the ground running. So my next step is I do a wax up based off the Photoshop. So this is my plan. I have little notes on the before model to show exactly where everything is going to go. And now I'm ready to go ahead and do the case. So here she is after with her 10 composite veneers. Once again, number 9, I bonded a composite veneer on top of her porcelain veneer. If you look really closely, yes, it's a touch more opacious because, you know, it is on top of a PFM that was highly opaque, but I think it looks pretty good and she's happy with it. And we can always go back and cut the whole thing off and change it to ceramic. And so here's her before and after. And that's the Photoshop with the after. And you can see, once again, I'm able to pretty reliably recreate these Photoshop designs in the patient's mouth. And here's her, this was the same day before and after. And before and after. Ooh, and you can see, so the white color that I use is right at the incisal, and you can see at the premolars, it's a really thick layer of white because I used the composite veneers to really expand the arch. And I think this occlusal view is a really good illustrator of that. And you can see how much we're able to expand an arch just with composite veneers, or it can be done in porcelain. The next type of veneer is partial veneers. And this is something that technically it can be done in porcelain, but I think this is pretty unique to composite. I don't see a ton of this in porcelain. And so this beautiful girl, she found us online. She came to us from Delaware. She did Invisalign. Her teeth are beautiful. The colors, the shapes. The one thing she doesn't like is she doesn't like that curvy ends to the incisal edges of these teeth. She calls them her Rick and Morty teeth. I never seen Rick and Morty, but really she's not wrong. It's actually pretty close. And so here's my treatment plan. And it's for 6 partial composite veneers because her teeth are beautiful. I don't see the need to do a full veneer that covers the entire facial of the tooth. So for her case, I'm going to do partial veneers, which means that the tooth at the gingival portion of her teeth is going to remain showing. I'm only going to add to the incisal portion of the teeth, and I'm going to blend them together. And so my first step is, of course, the Photoshop smile design. So here is the before and after. It's 6 partials. And it's not a major change. We're just addressing her chief complaint, which is those incisal edges. And then I take that Photoshop, I transfer it to my wax up. And once again, you can see we're only adding to the edges of these teeth. And then here's the final result. And so once again, the tooth at the gingival is her tooth. And then somewhere in the center, there's a blend between the composite that I use and the actual tooth structure. And this Cosmetic microfill. So I tried to trace where exactly the finish line is. Honestly, it's really hard to tell because the microfill is able to get such a beautiful blend line where it's really hard to pick up where it ends. And so here's the before and after. And really all I did was just kind of close up those embrasures a little bit. And here's her same day before and after. And I don't really post this case because it's not a dramatic change, but I actually, if you really do look closely, I think it gives her a little bit of maturity. She's in her 30s, and I think she looks a little bit more her age with these partial composite veneers. The dreaded single central incisor. So this is something that, once again, it can be done in composite, it can be done in porcelain. The case I'm about to show, it was on a 15-year-old boy. And so I did not want to have to cut that tooth down if I didn't have to. And quite frankly, I like doing single centrals in composite over porcelain, really for 2 reasons. First off, the composite has some translucency in it. And so the natural tooth shade can shine through a little bit more than porcelain. And so I think it is able to better color match than porcelain that's a little bit more opacious. And in addition, it's hard for these labs to do a color match when they're really just working off of a photo with a shade tab on it. Versus me, I'm working directly in the patient's mouth. And so I'm able to see how my color match is working. If I need to make any changes, I can cut it away. I can add opacers. I can add tints. I can do whatever I need to do to get that perfect match. But I have the luxury of having the patient right there in my chair. And so this is Josh. Josh plays lacrosse. He was in an accident when he was younger. So tooth number 9 is discolored, and it has a composite restoration that also isn't exactly the right color. And then number 8 is chipped as well. And so here is his retractive view. And so in terms of the treatment plan, so I'm going to do a full composite veneer on number 9, and then I'm going to do a slight edge repair on number 8. But then I talked to him and I talked to his mom, and I told them that I'm reserving the right, if I can't get the color match perfect, to also do a full composite veneer on number 8 if I feel like I need to. But let's see how close I can get. And then if I can't get close, we can always go back and do more. So my first step, of course, is the Photoshop smile design. So now I have my plan, and then I transfer that Photoshop smile design onto the model. So I've hand waxed this case, and now I'm ready to treat him. So here he is after. And all I did was that little chip repair. I didn't feel the need to go back and veneer number 8 because I think we got such a really nice color match and shape match on number 9. So I'm really pleased with the way this one turned out. So here's his before and after. Full face, before and after. Before and after. And what I do want everyone to just make note of is look at the health of the tissues in the after. What I find with composite is that it is so kind to the tissues that we don't see a lot of gingival inflammation around these veneers when they're placed well. And so I'm really, really loving the way this one turned out. Next up, we have trauma reconstruction. This beautiful, beautiful girl came to me. This was on a Monday morning. So over the weekend before, so on Saturday night, she had a couple of beverages and she got onto one of those electric scooters, and she was scooting around Baltimore. She hit a slab of concrete and then face planted into the sidewalk. And this is how she came to me. She went to some emergency clinic on Sunday, and they initiated a root canal on number 9. But other than that, she came to me pretty fresh. And so I'm off on Wednesdays. I was actually off today. And so what I did was I saw her on Monday. I was able to fit her in Thursday. I waxed the case on Wednesday in preparation to treat her. And this happened to be during very COVID-y time, so she was able to wear a face mask in the interim. So I'm planning this case. She came in, and I know I'm going to do my wax up. And so I asked her, Helena, could you just do me a favor and send me a photo of what your smile looked like before the trauma so I can try and recreate what you originally had? And she looks at me and she sends me the following photo. And she says, my teeth were really beautiful. And she sends me this photo, and I was like, oh my God, they were beautiful. So now I know that I have a very important task ahead of me, because my goal is to recreate this smile as beautiful or even more beautiful than it already was. And so in terms of treatment planning, so we know where we want these teeth to go. So this is my plan, but then we have to ask ourselves the question, do we do this case in composite or do we do this case in porcelain? And I would never argue with someone who decided that they wanted to do it in porcelain. It is an acceptable way to go. But this girl is 22 years old. I just can't, with a clear conscience, get myself to cut away all of this beautiful tooth structure if I don't have to? And so I begged her, even though insurance was actually going to cover more on a porcelain case, I begged her, please let me try this in composite. If it doesn't work, we can always go to porcelain, but let's give it a shot. And she agreed. And just one of the studies that I want to cite. So when we prepare a tooth for a PFM or for an all ceramic crown, we are removing 70% of the coronal tooth structure. And we're removing the enamel, right? We're removing the hardest part of the tooth, the part that's going to protect it from fracturing. And so for me, anytime, especially with a 22-year-old, I'm always going to try and preserve as much of that beautiful enamel as possible. And so I went ahead, I did my wax up, and here she is after. And so here's her same day, before and after. And what I do want to point out is I actually used a shade of composite that was a touch brighter than her natural tooth shade. And so if you look at the before and after, it looks a little bit brighter in the after, and that was intentional. And I think it blends really, it doesn't stick out to me. And what she told me is all of a sudden she's been getting a lot of compliments on her smile since she had this done. And so I think my goal was reached. I'm very proud of how this one came out. So here's her before and after. Before and after. And it's pretty cool, the realism that we're able to create with composite. I would argue that it could rival porcelain. So we're able to create that incisal halo at the tip, a zone of translucency above it, and then a body shade that blends into the tooth. I'm going to just jump through two kind of quicker cases just to show some other ways that we can use composite. So this patient came to me. He loves the shape of his teeth. He loves the color of his teeth. The only thing he doesn't like are these brown stains. He's tried bleaching. He's tried everything. They won't go away because they're intrinsic stains. And so I cut them out with a diamond burr. I filled them in with composite, and this is the result that we're able to get with composite. So here is his before and after. Before and after. And then finally, class 5s. And so this patient came to me. He's actually from Long Island, New York. His dad is a dental rep, and every time they need dental treatment, they actually drive down to Maryland to see us, which is such an amazing honor. So we had these class 5s. Not only are they stained, but there's also decay around them. And so I went ahead and replaced them. And here they are. So once again, we're able to get a really nice blend where it's hard to tell where the composite ends and the tooth begins. And so here's his before and after. And then here's the other side. This was the same day, so the gums are a little bit beat up, but also before and after. Okay, so very last thing. So I know I've shared a lot of facts about composite and my process. And so now I want to jump through one case, and we're going to go through the entire case from start to finish. This is Brooke. Brooke is fabulous. She was working at our office as a dental assistant before she went to hygiene school. So she was really amazing, knowledgeable assistant. We were sad to see her go to hygiene school, but she's going to do amazing things. And here is her before picture. And so she also had a little bit too much fun and a few too many beverages. Her accident happened on St. Patty's Day. She had a couple of drinks, she fell, and she broke her front 2 teeth. And so here they are. They're restored with composite, and the restorations are fine. There's no decay. There's nothing wrong with them. It's just, I think the aesthetics can be improved. The color can be improved, and they're on a slight slant. And so my first step is I do my digital mock-up. And so here is Brooke before, and then here is my smile design. So that's 6 composite veneers. So now I have my plan, and the next thing I'm going to do is my wax up based off the Photoshop. And so here is the wax up. And now I'm ready to take on this case. So I go ahead. So this is that incisal matrix I was talking about. So the incisal matrix is how I take the vision from the composite or from the wax up and transfer it into composite. Up next is the procedure. So the first thing that I do before I do anything, I don't pack cord for every case, and I can't even give you a rationale to why I pack cord in certain cases, but for this one, I felt that it would be good to hide the margin. And when I pack cord, I do it all at the beginning. So that way, if the gums were to bleed, it kind of resolves itself before I go in to do my veneer. The next thing I do is minimal tooth preparation. This preparation is a little more aggressive just because the teeth had already been prepared previously. And so I'm really just working back to the original tooth structure. And when we do these cases, we do 2 teeth at a time. So we do centrals, then laterals, then canines. Next thing I do is I isolate the teeth for our bonding protocol. So in this case, I use a Tofflemeyer matrix. Sometimes I use Teflon. There's really no rhyme or reason for why I would use either. Next thing I do is etch. A lot of our cases, there's no dentin to speak of because the preparation is so minimal. When we're bonding to enamel, we can etch a little bit longer. So I typically etch these for about 30 seconds to a minute, and you can see the adjacent teeth are protected. Next thing I do is I rinse and dry. I want to make sure that I can see that frosty surface of the enamel. Next thing I do is I place my bond. Because there's no dentin, I don't need any primer. So we use a Generation 4 bonding agent for all of our veneer cases. And so this is OptiBond Solo, and it's just the bond. I didn't use any prime for any of these teeth because there was no dentin showing. So we air dry it, we light cure, and then we're good to start bonding materials to these teeth. My first layer is an opaque white nano hybrid. So in this case, I'm using Dentsply WO. It can be any opaque white. So what I do is I place that WO into my incisal matrix, and then I smush it up against the tooth. I shape it a little bit, and then I light cure. Now, the purpose of the WO is to block out shadowing from the back of the tooth. So I don't know if anyone watching has had this experience, but you go to put a composite on the front tooth, and when the patient smiles really big, you can kind of see that line between where the tooth is and where that composite is, even though it looked fine while you were building it. So this WO, it blocks out that shadowing, so that way you can't see that transition between the veneer and the tooth. So here's the first WO shell, and I still have to do the adjacent tooth. So here we go. We applied the WO, which is the opaque white, on the other central into the matrix. We light cure, we remove the matrix. Now, if you remember that matrix, there's been a lot of work that went into that matrix, right? I did the Photoshop, and then I did the wax up, and then I fabricated the matrix. And the entire purpose of the matrix was this right here. It makes those 2 incisal shells. Once I have the incisal shells, I'm done with the matrix, which is so crazy because the entire rest of it is freehand, but it's funny that all of that work just went to these first 2 shells. So I put the matrix to the side. I actually place an isolate for the remainder of the veneer. I don't use the isolate before this point because it blocks the seating of the matrix. So the isolate is in place, and you can see those halos are built as well. And now we're going to build the rest freehand. So the next shade is going to be a translucent nano hybrid. In this case, I'm using Dentsply WE. It doesn't have to be this shade. It can be any translucent nano hybrid. And what I do is I use a thin instrument to place it on the edge near that halo and brush away the excess. Now, the purpose of the WE is to create that layer of translucency above the halo. The next thing that I do, and this is optional, this is a way to get kind of artistic, is I apply a white opaquer. In this case, I'm using a Cosmodent brush to apply Composite white opaquer to this tooth. And the way I did it in this case, and most cases that I just want a little bit of accent to the tooth, is I place it on the tooth, I brush it on, and then I brush it away as if we were to question why we even placed it in the first place. Now, white opaquer can be used for other things as well. So say we want to block out some shadowing on the tooth, or say we want to get artsy and make some hypocalcified splotches on the tooth in white. In that case, I would let it puddle a little bit before I light cure, and I wouldn't wipe it away. The next thing that I do, so if we look at these two teeth, and this is not for every composite veneer, but I did use it in this case. If we look, there's a gap, a pretty large gap between the tooth and the edge of the incisal edge because of the fact that we're adding so much length to 8 and 9. And so instead of letting that gap fill in with microfill, which is our final layer, I'm adding a nanohybrid in the body shade to reinforce that edge of the tooth. And so I'm using the nanohybrid just because it's stronger than microfill. It can be any nanohybrid, just make sure you're using the body shade. And I'm leaving about 0.5 millimeter of thickness for the microfill to fit on the facial. And then in this case, I'm using Dentsply Aesthetics HD, but really it can be any nanohybrid in the body shade. The next thing that I do is I apply the microfill. Now the microfill, it's a weaker material, but it's what gives the veneer that pop. So it should be the facial most layer of the veneer. And actually every case that I do, this is the one truly non-negotiable in my veneer cases. I use Composite microfill. I use so it comes in tubes and compules. I prefer the compules in my hands. And we use an Adent heater, which I believe is sold by Composite. So we heat the composite first to make it more sculptable. So here we are with the microfill in place. The next thing I do is I sculpt the microfill. And so really there's 3 instruments that I use. The first one I came with, that's my finger. So I kind of smush it into place. The finger is good because it's heated, right? And so the microfill responds really well to that. And then I use 2 instruments. I use a PFI. I believe this is by Composite, the BBA. I call it a PFI. I use that for the facial. And then I use a really thin instrument for the gingival and the interproximal. That instrument is also by Composite. That is a IPC instrument. But the purpose of the microfill is beauty. So once again, it's a weaker material. So we just use it for the final facial layer of the veneer, but it's awesome because it's color stable and it's very polishable. So that's how we're going to get that really beautiful shine. So here we are. We have tooth number 8 is complete with the microfill, and we're going to go ahead and apply it to tooth number 9. So same thing on the other central. And here, so microfill is applied on both centrals. We're going to go ahead and polish now. So the way that I polish, so I use an ET6 just at the gum line to remove excess. The entire rest of my polishing technique, I use discs. In this case, it's Composite Flexi disc, but it can be SoFlex, it can be any kind of discs. But it's important to use discs because discs are flat, and for the most part, teeth are flat. And so a common mistake that I see in these veneers is I see that they're a little bit too rounded. And a lot of times that happens because you're using a rounded burr to shape the veneer. So the discs are very important. So here I've gone through the full disc protocol. So I've used all of them to the super fine. So 8 and 9 are fully polished, except for a final polish at the end, which I'll get to. And now we're ready to move on to the laterals. And so I'm going to run through these. It's the exact same thing. So first thing we're going to do is we're going to prepare the teeth. This preparation is actually slightly more aggressive because the lateral sat a touch too facial. So I cut it back a little bit. We isolate the teeth for the bonding protocol. We apply our etch, frosted enamel following the etch. I apply bond generation 4, no prime was needed for these. So once the etch and bond are complete, the Tafelmayer is removed. We apply the opaque white first, which is Densify WO. So I load the guide, I shape it, and then I smush it against the tooth. And so here we can see the WO halos are complete. So now we're done with the incisal edge matrix. We can put that to the side and we can place our isolate. Next thing we're doing is the WE. So once again, we place it at the edge. We use a thin instrument to striate it and brush away that excess. Next up is the white opaquer. So I place the white opaquer and then I brush it away as if I didn't even mean to place it in the first place. And then finally, so for this one, I didn't use a nano hybrid because we didn't add so much length. So I went straight to microfill. So I apply the microfill, I shape it with my finger, with a PFI, and finally a thin instrument. The microfill has been applied, but you can see everything is a little bit rough. So now we're going to go ahead and polish those. And so now we're going in and I'm polishing the veneers. And 7 through 10 are almost fully polished. And now we're ready to move to the canines. So this photo actually shows how I prepared the canines. I left the Tafelmayer in place to protect the veneer so I didn't scratch them with my burr. So now we're going to do the canines. We etch, we bond, we place our WO, which is that opaque white, on that incisal shell using our matrix. The WE was placed. Now it's the white opaquer. Finally, the last layer is the microfill. So we didn't use any nano hybrid for this. We went straight to microfill, and I shape it the same way with my finger, a PFI, and then a really thin instrument. The microfill has now been placed and we go ahead and we polish it to completion. And so everything has been polished. So the front 6 veneers are placed, and then we're going to do our final finishing and polishing. So the first thing I'm going to do is I'm going to place, so right now the incisals are flat, right? Because I use a flat disc to polish, but real teeth, they have those grooves and valleys and ridges. And so they're not a completely flat structure. So the way I add back that anatomy is with a ceramus point at about 20,000 RPM. So I put that developmental anatomy back. Now it doesn't have to specifically be this burr. This is just what works good in my hands. A lot of clinicians use, it's like the Cosmodent, the rubber points and cups. Those work really well. It could be a red striped diamond. It's just whatever you find works good in your hands. And then finally, the way we get our veneers that pop is with Cosmodent Enamelize with the Cosmodent Flexi Buff pad. This is how we get the veneers to have that true shine. And you can even see between the photos and on the left and the right, how much more pop those final veneers have following polishing with the Enamelize. So, and this is what our hygienists use at just a regular recall visit to polish the Cosmodent, or to polish the composite veneers to make them look fresh at recalls. And here is Brooke after, looking beautiful. And here's her. I think this is the same day before and after, so you can see the gums are a little beat up, but I think it looks really nice. And then here's her same day before and after with the 6 composite veneers. And here she is at her wedding, smiling beautifully. Thank you all so much for hanging out with me today. I had such a blast speaking with you all. I hope you learned a lot that you can apply to your practice. And if you ever have questions, please reach out to me. We're on socials and there's my email, and I would be happy to chat with you. Thank you again.
Amazing job, Elaine. I'd love if everyone would just go into the chat and put one thing that you learned, Nacho team screenshot it. When we do these presentations, You literally put your blood, sweat, and tears into it. And it's great when you know what impact you're having. So we have so many people here watching and live on Zoom. We're going to do a few questions with Elaine. We also have a special guest to surprise Elaine in about 3 minutes and some sponsor interviews. But put what did you learn in the chat? Now, Elaine, part of live CNTV is some questions. We're going to do a speed round, okay? Speed round. So do you try to answer in as succinctly as possible? Do you soak your retraction cord with anything?
No.
No, good. I like this. Thank you. Was that just the traumatized teeth cared for? Gorgeous result.
Thank you. Wait, was that a question?
Did you just care for the traumatized teeth?
Yes, only 3 veneers. Yep.
Nice. Gorgeous. Do you have any pictures of your minimally removable tooth? Then you can go follow Elaine on Instagram, ask her that question there. Next question. When you repair a veneer, do you charge for a filling or a composite veneer or somewhere in between?
Great question. Somewhere in between. I'll call it like a one surface cosmetic. And so it's a cosmetic filling. It doesn't go through insurance. And so it is a cash procedure. But I'm not charging them out for a full veneer. It's a very small fee just to cover my time and the materials.
Awesome. And the last question I'm going to get, if you didn't get your question answered, DM Elaine on Instagram. How long do your composite veneers usually last compared to porcelain? Great
question. So I've only been practicing for 6 years, but I have cases from my first year out. So 6 years, still looking beautiful. I have had mine for 18 years. And so I can tell you from experience, I had these when I was 13 years old by my dad. And so I can tell you from experience, they can last when they are cared for. And that's what I tell my patients is, because they're always asking, okay, well, how long are they going to last? And I'm like, look, if you care for them, you're not doing silly things with your teeth. They have the potential to last a very long time. I'm the perfect example.
Awesome. And stay on with me. That's great. Do you treat any dentists? I have a feeling some of the dentists on here are going to go to Maryland and get composite veneers.
I treat a lot of dentists, and it is really just the high. I had to remove a dentist from my presentation because I ran out of time. But yes, we treat quite a few.
We'll have that Rocky too. We'll do the dentist, probably ask a lot of questions during it. I also want to let you know, during the presentation, I purchased a hamster and I named it Krebs Cycle. So I wanted to also have a pet named after something from dental school. If you watched in live, watching on demand, there'll be a survey with questions. Text code to 215-543-6454. You will get free C for watching in. If you missed the registration code, it means because you were not paying attention in the chat or you got here late, you can email c@dentalnachos.com. They will check Zoom to make sure that you are there.